Hello, everybody. Thank you for joining us today. Today brings another installment of Wellness Wednesday. For those of you who have been with us before, this is a monthly virtual series by Minneapolis.St.Paul magazine and sponsored by Northwestern Health Sciences University. So in conjunction with their in-house practitioners and their expert providers, we join forces to cover hot topics in natural health, and no stone goes unturned. Truly, we've explored Ayurvedic medicine together, the juncture of where Eastern medicine intersects with Western medicine, modalities like acupuncture, but for things that may not be as known, like immunity and headaches and things like that. Probiotics for gut health, and all of that just barely scratches the surface. So if you've ever missed an episode or you want to explore the sessions that we've produced together in the past, then I encourage you to visit our YouTube channel, which is youtube.com/MSPmag, and you will see our collection housed there. I'm Jamie Korf. I'm your host for Wellness Wednesday, and today I will be joined by Dr. Barbara Gassi. We will be covering ADHD, which is recognized as a behavior disorder in Western medicine, and then we'll learn together how it's viewed through the lens of Eastern medicine, the sort of hallmark signs or symptoms to look for, along with treatments, regimens, and a bunch of pro tips. ADHD, which stands for Attention Deficit Hyperactivity Disorder, is on the rise in adults. You know, for so long, the personification of ADHD was like that unruly boy in the classroom that fidgets a lot and doesn't listen to the teacher. But the medical community, the mental health community has made a lot of strides since then. We now know that the ratio is pretty much 50-50 among boys and girls, and that it's also something that impacts many, many grownups. So there are some who have gone their entire lives undiagnosed, and that is what doctors refer to as the lost generation, specifically among women. So while awareness of ADHD is greater, it's sort of a double-edged sword. Social media has everyone thinking that they have levels of it. To the point where a common refrain is something like, oh, it's probably my ADHD. So, self-diagnoses are becoming prevalent. And yes, you can have ADHD, or you could have anxiety or depression, or just to complicate things a little further, you can have all of the above. So as you guys can see, ADHD is a very complex issue, and it's very individual at its core, but with Dr. Gassi at the helm today, she will be helping us sort of break things down and sort of paint what that Venn diagram looks like between ADHD and related questions. So make sure to bring all of your questions today. We will do our best to address every single one of them. And then before we dive in, we just want to say a quick note that our sponsor, Northwestern Health Sciences University, they are a leader in natural health, and they are the top chiropractic school in the Midwest. Among their menu of programs and services, they offer acupuncture, they do cupping, traditional Chinese medicine, massage therapy, and much, much more. And their Bloomington clinic is open to the public, and they offer natural care services there. So with that being said, Dr. Barbara Gassi, we are ready for you. She is an assistant professor at the College of Acupuncture and Chinese Medicine at Northwestern Health Sciences University. She has been featured on Wellness Wednesday before, and we are so delighted to bring her back.
Well, thank you. Hi, Jamie, and thanks for having me back.
So thanks for being here, Barbara. ADHD, super, super hot topic, as I was sort of alluding to. Like I said, it's sort of like a two-way thing, where it's great that we know that it exists, that the lost generation, specifically younger women, are being met with more diagnoses than they were in the past, but now everyone sort of thinks that they have, varying levels of it. So with that, just to start things off, Barbara, I wanted to know, and again, I encourage anyone in the audience to ask questions at anytime throughout the session. We highly encourage engagement here. We want it to be very conversational in nature. But Barbara, have you found sort of an uptick of patients coming in, feeling confident about having ADHD before getting like an official certifiable like clinical evaluation? Or have you seen any other types of patterns over the past 2 years, specifically since the pandemic sort of started?
Played its role in it all. Well, I thought that was an interesting question, Jamie. And I would not say that I've seen an uptick in people coming in confident that they have a diagnosis of ADHD without having a medical diagnosis of it, which I think is interesting. However, I do see an uptick in people having spent more time cruising through the internet looking for information. And I think there are elements of that that I think are really good, and elements of that that can actually worsen one's symptoms unless they maybe get some intervention or some help with it.
And the reason for me asking specifically was I did some research fairly recently for an article, and it was based off of an observation that I had personally made in my downtime. And that is, there is a whole group of people on TikTok, which we know is, very popular with the younger generations, and these influencers on this platform that may or may not have received a clinical diagnosis are just kind of shooting out, various like symptoms or signs that they've experienced. Um, and so people resonate with that. And they're like, that must be what I have. That's got to be it. And so I had just wondered if maybe people, now that we're maybe a little bit more empowered and take more initiative with our own health, especially since the onset of the pandemic, I just wondered if that was sort of like a phenomenon that, clinics everywhere, mental health clinics were witnessing. But it's also great that people are being a little bit more cautious than what the internet may sort of put off.
Yeah, I think that people are definitely looking at different mechanisms or different symptomology or different platforms where people are highlighting a group of symptoms. They're definitely coming in with that, and especially your age of person, my age of person, or children have not really spent the time cruising the internet looking at all of that. But certainly people who are in your age group have done that for sure. Have they come in and said, I know I have this? They really have not done that. And so when I look at that, I go, it seems to me that that's sort of a double-edged sword. One is that there is a sense of empowerment that it can give people, and there is a certain sense of education that it can give people. And I think all of that's good when we're talking about patient-centered care. I think you have to be cautious about any kind of diagnosis and make sure that if you're going to state that you have a particular diagnosis, whether it's ADHD or whether it's heart failure from a Chinese medical perspective, that you actually have someone whose scope of practice allows them to make that diagnosis for you. And so I do think that it's a good thing, and I think it's a double-edged sword. And in terms of the TikTok people or the people on social media, I think I was thinking about this in relationship to a topic that I was having with students about whether or not dry needling was okay for other people, other professions to do. And one student stated that they thought that the way to go about it was to make dry needling, or some would say acupuncture, accessible to everyone, but to put in a preface statement about that dry needling is not Chinese medicine, or a diagnosis of ADHD can only be done with those who have that within their scope of practice. And so I think that a way to mitigate people maybe making the decision that that's what they have is to have the platforms mandated to say that these are symptoms that they experience or perspectives that they have, but they're not licensed to make the diagnosis of ADHD.
Yeah, that's a really good point, doctor. People sort of disclosing that, since those platforms are so influential, people are sort of skipping over brands and getting, service or product recommendations from people. It's sort of like crowdsourcing, but in the modern age. And so, but at the end of the day, we all have a responsibility, especially when it comes to any type of medical advising on the internet, where you're exposed to potentially thousands and thousands of people.
Right.
My next question for you, Barbara, and maybe this should come in later, but I wanted to know, is there any sort of a cause for ADHD in children and adults? Like, is this something that people, and I know that this is going to sound naive, but is this something that is just kind of in somebody's genetics? It's hereditary? Or can there be sort of a culmination of situational things that eventually sort of, I guess, initiate that in a person?
So there is no known etiology. When you look at the research, there's nothing that says this is the cause of ADHD. What they do say, or what the research does say, that about 70 or 60 to 75% of children who are diagnosed with ADHD actually have a parent who have a constellation of similar symptoms. And so the research sort of leans heavily to that there's a genetic component to it. Now, there's also interesting information on gut microbiomes and what do they maybe have to do with the symptoms of ADHD. And we can get into that now, or we can get into that a little bit later. Your choice on that. And I actually think that that's a very interesting set of phenomena that can cause symptoms like ADHD.
Barbara, I got a question from the audience and I wanted to ask it um, before I forgot. So this person wants to know, and I think this is a really good question because there are facets of this that can be found in each. And that's where that overlap comes into play. But somebody wants to know, do ADHD and depression typically go hand in hand?
Yeah, I would not say that it's a typical thing that ADHD and depression go hand in hand. However, ADHD is often accompanied by other things or other comorbidities. So anxiety, depression, addictions, they all tend to or frequently are in a similar constellation of symptoms.
Is it more common, Barbara, that somebody has that overlap, that, like you're saying, that constellation of other symptoms, or is that more common than just somebody having ADHD and that's that?
It's common, it's very common to have another set of symptomology or other comorbidities, especially things like anxiety, depression, addictions, insomnia. All of those are sort of a subset of symptoms that go along with people who may have ADHD.
That that sounds great, Barbara, and that really clears things up. And I know that, ADHD could probably exacerbate certain symptoms, or maybe symptoms of anxiety, or like OCD can have symptoms of, can overlap with symptoms of ADHD.
Absolutely.
Clear as mud.
Absolutely. They can
Uh,
definitely go concurrently with each other and
okay,
easily contribute to an exacerbation of symptoms.
sure. Um, it has been said, so we've done an article on this before, Barbara. We called it ADHD Turns Eastern Medicine on Its Head. What was interesting to me in that process was learning that in Eastern medicine, and correct me if I'm wrong, obviously, ADHD isn't really recognized or acknowledged as a disorder. It's more about having an excess of yang in the body. Can you sort of share, like, elaborate on that a little bit more, and then just maybe sort of walk us through the lens of um, ADHD from the world of Eastern medicine?
Sure. So remember that the diagnosis of ADHD is a Western medical diagnosis. So it has to be diagnosed by someone who has a license that's got the capacity to do the assessments and make that determination. Just like Chinese medicine, I don't have the capacity or the scope of my practice to say you have ADHD. But if you come in and say that you have this constellation of symptoms, so for ADHD, usually it's assessed through a constellation of inattentiveness, hyperactivity, and impulsiveness. And so if you came in and you said you had a constellation of symptoms within those categories, and I did an intake with you from a Chinese medical perspective, I might come up with that you have, so there are really about 5 basic constellations of Chinese medicine and ADHD, or what people might call ADHD. And so when we say, or when you say, is it an excess of yang? Well, it could be. It could be an excess of yang, or it could be a deficiency of yin manifesting as or looking like an excess of yang, but really isn't an excess of yang. It's a deficiency of yin or nutritive substance. Or it could be a deficiency of the spleen and the spleen's ability to metabolize your food in a way that actually gives you enough nutrition. And if that is deficient, that can affect the heart system in Chinese medicine, producing what looks like symptoms of ADHD. Or you could have a stasis of liver qi and a deficiency of spleen, which can also cause symptoms that look a lot like ADHD.
Barbara, forgive me for mispronouncing that. I think I said yang. It's yang.
Well, it's okay. I think that everybody has their own way of saying it, and so
Okay.
that's
Thanks for making me feel better.
that's not a big deal. That's not worth putting time and energy into perfection of
Sure.
that stuff.
I'm going to kind of rein us back in. And can you talk to us about yin and yang and, like, the significance of that and how that plays such an instrumental role in the diagnosis of, I'm sure it's beyond ADHD, right? Other conditions. And
Diagnosis of anything.
yeah, can you just talk a little bit more about that, Barbara?
So yin yang relatively translates as balance, and yang is active, metabolic, warm, providing nutrition, or allowing the metabolic process to happen, where yin is cool, it's nutritional substance or nutritive substance. And when either one of those are out of balance, it impairs the function of the other one of them. And so that can, down the line, create a set of symptoms that look like whatever. Today it's ADHD, but it could look like headache. It could look like a lot of different things, infertility, if you will.
And how is that detected, Barbara? Is that with you starting by, you said, an intake? So looking at the patient's tongue, is that a very telling sign?
So there are 4 pillars to diagnostics in Chinese medicine. One is inquiry, asking questions. And so you would do sort of a general intake with someone that would include head to toe inquiry. Then there is observation. When you look at observation, that's where you would look at the tongue. And the tongue has a map And the map of the tongue shows really what's happening in the digestive system, what's happening with the quality of the blood, and is there any pathology in any organ area of the tongue. And then we would do something called palpation. And we may palpate the radial pulse. When we palpate the radial pulse, there are 12 pulses that we palpate at 3 different levels. And those 12 pulses equate with the different organ systems in the body. So we can assess the organ systems and their relationship to each other based on the pulses. And then we would it's called olfactory or auscultation. And olfactory and auscultation are, what are the smells that come from your patient, or what are the sounds? Do they have any wheezing in their chest? Do they have any shortness of breath? Do they have any other sounds or odors that are coming from their body? And then you take that constellation of 4 pillars and come up with a diagnosis.
That's so fascinating to me and very uh, not consistent with what we're used to when we visit the doctor's office. That's for sure.
That is all
I'm
true.
very intrigued now. I mean, I was before, but especially now. So thank you for walking us through that, Barbara. I'm gonna bring us back to ADD or ADHD, in that we did receive a question from one of the registrants prior to today's session, and they wanted to know, ADD and ADHD get conflated with one another often. Can you talk a little bit about what some of the, I guess, hallmark differences look like between the two?
So I'm going to do this by sort of giving you the definition, the DMS-5 code. So that's the diagnostic code that medical providers would use to assess ADHD or ADD. So ADD, attention deficit disorder, ADHD, attention deficit hyperactivity disorder. And so ADHD is typified by the 3 components that I mentioned earlier: inattentiveness, hyperactivity, and impulsivity. And so if a child were diagnosed with ADHD, they would have to have 6 components of these, and I'll go over them in a second. They would have to have 6 components of 2 categories of these that disrupt 2 areas of their life for over a 6-month period of time, where adults have to have 5 of those symptoms that negatively impact their life in 2 areas of their life for over a 6-month period of time. And so when we look at inattentiveness, what we see are an inattentiveness to details, or an inability to stay focused on tasks, poor listening skills, or the inability to follow through with tasks or instructions, poor organizational skills. They avoid tasks that require sustained mental effort or attention to it over a period of time. They lose tools to help them accomplish their tasks, like glasses, for example. And they're distracted by thoughts or other stimulation. And that's the inattentiveness part of it. Then there's the hyperactivity part of it, where the individual fidgets a lot, squirms, they're not able to stay still in their seat. They move around from location to location rapidly and multiple times. They have difficulty playing in leisure activities. It would be hard to sit and play a game with the family or something like that. They're unable to sit through meetings. They maybe have excessive talking. And then there's the impulsivity component of it. And that's where the individual might speak out of turn, or they might have difficulty waiting for their turn, or they intrude in on other people's conversation. And so, again, as I said, that to have ADHD, you have to have multiple components of this that affect 2 areas of one's life for over a 6-month period of time. And that's really where the diagnosis of ADHD comes in. That diagnosis would be outside of my scope of practice unless someone came in with a medical diagnosis of ADHD. I would call it something differently, like heart fire or phlegm misting the mind, or I might call it a spleen heart disharmony. But the constellation of symptoms may be the same constellation of symptoms. It's just outside of my scope of practice to call it ADHD unless they've already been diagnosed.
Okay, so that's interesting. So, if you suspect that you have it and the practitioner suspects you have it, and then you kind of venture off and you record your life for those 6 months and check to see if there's major interference, is that just something that's done via, how do you sort of track that? Is that like journaling, checking in with your doctor? What does that process look like, Barbara?
If somebody wanted a diagnosis of ADHD, I would go to a qualified professional who can actually um, take take the questionnaires that really assess that and make that diagnosis for the individual. If they're not seeking a Western medical diagnosis and they want treatment for a constellation of symptoms that may look like ADHD, they could certainly come to me and I can do that for them. But I can't make that diagnosis for them. If I suspected it and thought that it may be appropriate to have diagnosis, I would refer them out to a practitioner who could do that.
Okay, I understand now. Um, you talked about the spleen a couple of times, and I know
Uh-huh.
that I don't know if you call it the organ body clock, but um, we've done a couple of sessions on the Chinese medicine organ body clock and how that impacts sleep. Um, can you talk about the role that the spleen plays into something like ADHD? Why is it that particular organ?
Well, it's not just that particular organ, but I'll tell you how that particular organ plays its role in ADHD. So, from a Chinese medical perspective, the spleen and the stomach organ system. So, when I talk about organ systems, I'm not just talking about the stomach, the organ, and the spleen, the organ, but I'm talking about the multifaceted functions that those organs play a role in Chinese medicine. So, for example, we say that the stomach rottens and ripens the food, and the spleen pulls out the pure from that and sends it up to the lungs, which help make blood. And when the body is well nourished, then that circulates through the body via blood or via qi and provides nutrition to the body and keeps the body in balance. When the body doesn't do that well, what happens with regard to ADHD is there's a poor quality of or a deficiency of blood. And that deficiency of blood and deficiency of spleen qi can cause symptoms of ADHD.
I Let me know if I'm jumping around, Barbara. I know we only have so much time, and I want to make sure that we tick off all the questions that we've received and that people um, still submit questions along the way. I know that in Western medicine, ADHD is they talk a lot about having, and I mean this is I guess similar to depression and other mood disorders, but that those with ADHD have low levels or lower production of dopamine and serotonin.
Mhm.
Can you talk to us about those neurotransmitters and how they link back to, say, gut health? I know that a lot of mood or behavior disorders, I don't want to say hand in hand, that's obviously talking out of turn, but there's a lot of gut disruption that kind of go alongside some of that.
So I read a really great article. It was just fantastic talking about microbiomes or prebiotics, probiotics in the gut. And there was a lot of research done with regard to ADHD in terms of how does poor gut microbiomes affect ADHD, and that there is three mechanisms of action where that occurred. One was through nerve pathways. And so what happened in that case was the gut is innervated by the hepatic and the celiac branches of the vagus nerve. And then that has a significant role, the vagus nerve, in mood regulation. So when microbiomes were weak, then it really, through the nerve pathways, affected mood. And then there were the neuroendocrine pathway. And so what happens, that's where you have dopamine and serotonin. So when microbiomes are deficient, or there aren't enough of them in the body, it then can affect the production of and the movement of both serotonin and dopamine, which then affect mood and cognitive regulators. Then there was another pathway called the immune pathway, and that pathway really had to do with blood-brain barrier system. And what happened in that case is when there was a deficiency of microbiomes, then what happened is the mechanism that went from blood to brain really caused inflammatory responses, which could then cause symptoms of ADHD.
It's so interesting to learn how more and more research comes out about sort of the intrinsical the value of having and maintaining good gut health and what that does for your other brains, since now they're kind of calling, the microbiome your second brain.
And the thing about that I think is really interesting in terms of ADHD is that if you look at over the last 50 years, the way the way our food chain has changed has, in my opinion, had a significant impact on um, gut microbiomes or brain gut connection. And I think it's really important to be mindful of that, that how we eat. So hahighly processed foods, for example, kill out a lot of those important bugs that go into our digestive system and actually help or make a connection with gut brain and gut brain barriers.
Um, Barbara, one of our audience members has a question, and she says that she has a 10-year-old with anxiety and OCD, as well as presenting with symptoms of ADHD, and curious to know how this all fits together and overlaps. I know that we've kind of touched on that, but if you want to talk about, I guess this is once again that constellation that you were speaking of earlier.
So without a diagnosis of ADHD, of course, I can't say that child has ADHD. Here's what clinically I see. And there are a couple of things that happen from a Chinese medicine perspective. One, children develop on 7 and 8 year cycles. So girls develop on 7-year cycles, boys develop on 8-year cycles. And a lot of times you'll see symptoms show up at those age cycles of the individual. And so a part of what we look at is where in their development cycle are they at? Which stage? Is it stage 8 years? Is it stage 16 years? Is it stage 24 years? We look at all of those stages. So we look at that. And then looking at the other symptoms, we make decisions about how are we going to treat this child. Usually children who have those kinds of symptoms, right? Inattentiveness, hyperactivity, impulsiveness. And if they've had this sort of their whole life, there's an element of genetics that I would look at, or an element of, from a Chinese medicine perspective, kidney deficiency. So kidney really is the base of life, and we get our kidney energy from our parents and from the food that we eat as we begin to eat food in our life cycle.
Speaking of food and also gut health, Jan wants to know, Barbara, if you can share some best practices to nutritionally improve your gut health.
So having foods that have probiotics in them. So yogurt is an example of that. Now, the caveat to yogurt is you don't necessarily want to go out and buy the yogurt that's full of high fructose corn syrup or high sugar, and the probiotics have all been killed out of it. You really want to buy a yogurt or make a yogurt if you're so inclined to make stuff. Make a yogurt that's got a lot of the microbiome in it. That's already living. So doing that, having foods that are rich in omega-3s and omega-6s really help augment the movement of those nutrients or those bugs that stimulate brain function in the 3 different manners that I'd said earlier.
And I guess, I know you said yogurt's a good one, Barbara. I drink a lot of kombucha. I had a disease about 12 years ago that required me to really up the ante on good bacteria.
Mhm.
And I've been drinking kombucha ever since, but now it seems like everything has probiotics in it. Probiotic pop, there's kombucha beer. So,
So you want to, oh, sorry.
oh, go ahead. Go ahead.
You want to remember that the bugs are easily die out. So buying products
What
that
does
are,
that mean exactly, Barbara? Not to interrupt, but what do you mean by the bugs are dying out? Like just
well,
because?
if you buy, let's say, probiotic soda pop, right? I would question how much of that probiotic is actually alive and in that soda pop as you drink it. And so is it really replenishing? So one of the things that we talk about is probiotics. We frequently keep them in the refrigerator because they die very easily. And when you buy a bottle of a probiotic, you can see that there's a certain amount in that, a certain number of little bugs in that bottle for a suggested period of time. Once that time runs out, the bugs kind of start to die out. And so you have to be careful about how are you getting it. And really, I think the best way to get it, if you can, is through nutrition. But you want to make sure that your nutrition is relatively unprocessed. Otherwise, the viability of those little critters, they're fragile, and they don't just last forever in your soda pop.
That's really interesting, Barbara. Jan wants to know if kind of as a continuation to that, if a probiotic is helpful or some type of other supplement.
So when I looked at natural supplements, and I'm going to say this with a caution because I don't want people to go out and buy probiotics and buy some other kind of supplement without really having an assessment done by a professional who could do that kind of assessment. But the research does say that probiotics, that omega-3s and omega-6s, or foods that are rich in omega-3s and omega-6s, actually really help the symptoms of ADHD.
Interesting. So things like salmon or
Salmon, walnuts,
walnuts.
tofu, soybeans, flaxseed, all of those things have good omega-3s and 6s in them.
Okay. And that's good for heart health and brain health.
Heart health and brain health. That's all true, right? Or the brain body connection.
For those of you out there that aren't big walnut fans, oh, there's your little kitty.
Oh, in the background.
Um,
My cat.
I have a little pro tip, and I learned this from my in-laws. Cheerios, whether it's regular or Honey Nut Cheerios, and then you throw some walnuts in there. It sounds really weird. Throw some walnuts in there, like quarter of a cup, maybe put a little bit of honey on top if it's locally sourced. So good, and you get your omega supply usually. And it just sort of changes the game. I can't even eat Cheerios without walnuts anymore.
That's cute.
Just thought I'd throw that in there. um, I have a question about being undiagnosed, Barbara. So, if a person is a part of that lost generation where they have had symptoms, but maybe they've just thought they could manage it, and learn to sort of work around it, or in the business place, at home, et cetera, with relationships. Is there any harm to not getting treated for ADHD? Is there anything that's happening on a chemical level where there's something damaging to the heart or the stomach or the brain? I'm not trying to, put the fear of God in people. I just want to know if letting that sort of go, even if you think you can manage it, has any sort of deleterious effects.
I I would say that if there are areas in your life that are not going well and you attribute them to the symptoms, then I would highly recommend that you are diagnosed, because what you may do then is be triaged to people who can help you. So, for example, cognitive behavioral therapy is one of the tools that's used to help people. Maybe you're so disorganized and you just can't manage a project at work, right? Or your garage is such in disarray because you just can't seem to pull it together. If those are affecting your life, then I think it's important to have a diagnosis. Remember that your body, or every individual's body, belongs to them, and so ultimately we get to make decisions about how we go about our treatments, right? And we can do Western medical treatment, or we can do Eastern medical treatment, or we can do a combination of all kinds of cognitive behavioral therapy or some other kind of psychotherapy that may help us organize and develop our skills a little bit in terms of organization and planning. So there also, it may be important in terms of getting support so that you have insurance reimbursement for some kind of treatment. Those are all important factors.
Um, and I guess sort of the source of this question came from, I was doing a little bit of research before our session today, and I saw a few studies that linked ADHD, sort of unmanaged, with people that have it are more prone or maybe more susceptible to Alzheimer's and other forms of dementia. Have you heard anything about that,
I
Barbara?
have, I have read little components of that. And of course, certainly that would be long term. And from my perspective, that looks like a nutritional component or a
Got it.
metabolic component.
Got it. Okay. My next question for you is, we talked a little bit about how we can try to manage some of the symptoms through diet changes. What about some other forms of treatment or regimens? Like, what about with our lifestyle? How do we work around that?
So are we talking natural treatments? Are we talking Western? Okay, natural
Natural.
treatments. So, of course, CBT, cognitive behavioral therapy, is one of the things that came up a lot in my research. Omega 3s and omega 6s came up a lot in my research in terms of treatment. I would, especially when there's a hyperactivity and an inattentiveness, I would probably incorporate either some Qigong practices, which are breathing movement practices, or I might incorporate some yoga positions that actually uh, bring down the anxiety levels. So there are yoga positions that could stimulate more anxiety, or yoga positions that could actually bring down the levels of anxiety. And so I would find a yoga practitioner who could teach me some of that. Or there's a beautiful book that I just read called Trauma Healing Through Yoga. And it was a spectacular book breaking down the difference between the sympathetic and the parasympathetic responses. And I would suggest all of those. And of course, nutrition.
Right. I suppose having good sleep hygiene, but that would probably, I mean, easier said than done. I know that's
Yep.
paraded around all the time. But I can imagine that's probably good for regulating your emotions,
Yes.
right? When you have a good night of sleep.
And also helping in getting to sleep or staying asleep. So a lot of people who are diagnosed with ADHD also have insomnia, and that can be either from the medications that they're on, or it can be from the hyperactivity that they feel. And so, the research has suggested good sleep hygiene. So shut off all electronics an hour before you go to bed, making sure it's quiet or that you have some white noise that goes on, however that works for you, and making sure that you sleep and wake at the same time every day.
Hmm. Hmm. Okay. Yeah. And screen time, I know again, that's always easier said than done. But it has been written about, it's been said that maybe it's the blue light from the screen can
Uh-huh.
suppress some of those neurotransmitters like dopamine and serotonin and things of the like.
Right.
Um,
Exactly.
let me see if I have any more questions from the audience here that I haven't touched on yet, Barbara. How to recognize adult. We went over that. ADD. We went over that. Let's see here. How to help. I don't know if this is relevant to our conversation, but I'm going to throw it out there anyways. How to help to maybe self care while caring for a family member who also has ADHD, which brings a good point that ADHD isn't something that lives in a vacuum, that can affect other members of the family as well.
Likely, likely will affect other members of the family. If a parent has symptoms of ADHD, it is likely that a child will also come into the family with those symptoms. And so learning as a parent, remember that parents were the role models for our children. And so learning good self-care techniques for oneself actually role models examples for the child to then develop skills that may help them with their ADHD.
That's such a good point, Barbara. I mean, ultimately, we are the role models for our children, especially at those those cycles you were talking about before of girls with the 7 year cycle, boys with the 8 year cycle. Carrie wants to know if you've seen improvements in ADHD symptoms with acupuncture or other physical therapies like chiropractic. It's a great question.
I have seen really positive responses with Chinese medicine, and I'll only speak to that because I'm immersed in Chinese medicine, and it's where I spend the bulk of my day. And so I have seen people have better regulatory, have developed better regulatory skills, both children and adults. And by calming the system, I think it allows people to learn the skills of organization and management of time and management of whatever it is that needs to be managed in their life.
That's a beautiful response, Barbara. It is so amazing as the years go by and just how catch all acupuncture has become. I mean, for the longest time, I mean, obviously in the Western side of things, but for the longest time, it was touted as being, an integrative therapy that was good for chronic pain. And people are learning that there's just so much more to hitting these various points on the body and how that can manifest in different ways to help you with all the way to, mental health and fertility. I mean, it's really striking.
Yeah, the standard Westerner, the bulk of us learned about Chinese medicine when Nixon went to China and one of his publicists got an appendicitis and had surgery and had acupuncture for pain, and then came back to the United States and wrote a story about it. And that's really um, one of the main ways that acupuncture got publicized in the West. But the truth is that there's all kinds of people all through history who have practiced Chinese medicine slash acupuncture all through the history of the United States. And I think the important takeaway from that is that Chinese medicine, acupuncture is just one tool in Chinese medicine. And Chinese medicine is a whole system of medical thinking and medical assessment. And so, like Western medicine, you can assess all kinds of conditions,
Mhm,
right?
mhm.
And so I think the way to look at this is to really go, where does Chinese medicine fit in? How does it fit in? It works wonderfully for chronic conditions versus how does Western medicine work? Western medicine is good with diagnostic tools and they're good with acute conditions, right? Or good with trauma conditions. And so knowing where and how to incorporate different types of medicine into one's life, I think is really a gift and the trick for optimum health.
Absolutely. Maggie wants to know, Barbara, we were talking about the importance of having good sleep hygiene. And then you had also mentioned and singled out the fact that many people with ADHD also have, insomnia or other types of sleep disorders. And she wants to know what modalities out there within the Chinese medicine world specifically help um, with bouts of insomnia.
I would probably use a combination of acupuncture and herbal medicine.
Okay.
When oh,
And that's something, the herbal medicine, Barbara, that's something that obviously, I mean, you can't just go into like an herbal dispensary at Northwestern. They would need
you
um, a separate.
assessment,
Okay.
yeah, and a prescription written for you. Now you can because herbs are non-regulated, you could just go onto Amazon and buy herbs, but I would not suggest it. There's about 400 primary formulas in the Chinese herbal medical materia medica, and 400 herbal combinations could have all kinds of effect on you and have a lot of different effects depending on the kind of medications you may be on. So you have to be very careful if you're going to be taking herbs.
And that leads me to a question that I had before that I forgot to mention and address with you. Are you actively seeing patients, Barbara, or accepting new ones?
Well, I will be as soon as I get back to the clinic, but because I broke my leg this
Okay.
winter, I've been out. I anticipate that I will be back in the next 4 weeks, but there are wonderful practitioners. There's Megan Mabe, who I think you've met, Jamie, and Sarah,
Weaver.
Sarah Weaver, and uh, Leah May. Oops, I forgot Leah's last name. I'm sorry, Leah. Um, but there are 3 practitioners at Northwestern's Bloomington Clinic that are great.
Okay. I'm typing that into the chat box for everyone. And then hopefully, Heather, I don't know if you want to add the phone number in there for. Um,
It's 952-885.
oh,
Oh,
this just went to panelists. Let me,
I'll pull the number up here.
panelists and attendees. Here we go. Okay, and the number, Barbara? I should have it memorized.
It is 952-885-5444.
444. Okay, beautiful. I typed in Leah May. Will the
Perfect.
receptionist know? Okay.
Yeah, they
Um,
certainly will.
we're running out of time here. If anyone has one last question. Okay, somebody said they missed the part. Oh, I don't know if we have time for that. We're related to the genetic component of ADHD. Is there a way we can sum that up, Barbara?
The statistics say that somewhere between 60 and 75% of children who have a parent with symptoms will have symptoms of ADHD.
Okay, got it. It's a stat. Okay, got it. That's a pretty staggering number.
That is, I mean, that does make one see that genetics play or appear to play a significant role in this.
Big time. Okay, I think we're going to wrap up here. Dr. Gassi, it's always a pleasure to have you on. You just have this like zen that you emanate, and it like calms me. So thanks for bringing that. Hopefully that happened with the other attendees. It's just like this zen, like, oh. And I hope that you feel better soon and that your leg heals up in no time. Thanks so much for joining us and for sharing your knowledge. You are such a gift to Northwestern. So it was a real privilege to have you again. Such a treat.
Thanks. Looking forward to another time. And
yes, thank you, Dr. Gassi. Thank you. And then to everyone else, this is recorded. This will be posted on our YouTube channel within the next couple of days. That's youtube.com/MSPmag. And next month, we're going to be talking about it. It falls on May 18th. It's always the third Wednesday of the month. And it's always at noon until 1 o'clock. We're going to be talking about how exercise changes your brain. Really exciting stuff, and a lot of new research from this particular doctor about how any type of movement can actually like generate new brain cells and thicken your cerebrum. Thanks everyone for joining us, and we'll catch you next month. Happy spring. Let's hope this goes away soon by the time that we talk next. Thanks everyone.
Thank you. Bye-bye.
Bye-bye.